Hello, and welcome to Coffee and Conversation AI in Healthcare. It's my pleasure to welcome today Professor Shah, Chief Medical Strategy Officer at Numan, visiting lecturer at UCL Global Business School for Health, consultant at NHS, former Director of Digital Development at NHS, and much, much more. A pleasure to have you. Did I get it right, Sam? Can you say a few words about yourself?
Thank you, Michael. Thanks for inviting me. You certainly got it right, and apologies for the extensive and long introduction that I left you with. But a little bit about myself, I guess. Well, I'm a clinician, I'm a lawyer, and I'm a digital health enthusiast. And I still sort of operate across all of those areas. I mean, super lucky. My career has sort of spanned everything from retail technology, financial services, and healthcare. But most importantly, right now, I am trying to help men improve their health through Numan and trying to create citizen-centric services that really deliver elements of healthcare to people that really need it, and want to make a difference to their future outcomes and lives. So super interesting to be here today, and really looking forward to our discussion, particularly because you've picked a range of topics that are really important to me.
Awesome. Thank you so much. And let's dive in then. So recently, Sam, I came across the Washington Post article entitled "How the UK Became a Terrible Place to Be a Doctor." In this article, there is interesting quote, really scary quote, to be honest, that is saying that opening quote, there were around 124,000 healthcare vacancies in England. Of these, nearly 9,000 were doctors, though that surely understates the extent of the problem. By 2030, 1 in 4 general practitioner posts are estimated to be vacant. And end of quote. And here's my question, what are your thoughts from your perspective as both being a practitioner, NHS consultant, digital health expert? Do you think AI will play a role in alleviating this problem?
Well, I guess the first thing is what is the problem, right? And
Yeah.
I think the problem is multifactorial. We've got rising population needs. We've got an aging population, got massive burnt out and an underpaid workforce. In addition to the burnt out and underpaid workforce, there's insufficient workforce. There's the rising cost of healthcare, and there's widening health inequalities. So it's not just one problem, but it's multi-layered, multifactorial, and without any doubt, we've got the increasing complexity of comorbidities and disease in a way that didn't exist before. So you put all that together, and there's a melting pot of problems. So going back to your question, could AI play a role in this? Well, it probably can, but it depends on which part of the problem we want to focus on. So the way I think of it is, no doubt, artificial intelligence in its multiple facets could, of course, help in due course, but it needs to be proportionate. We need to think about the risk level that we're happy with, the safety, the security. We need to think about how we evaluate the type of AI and work out where, how, when, and why it can be used. And there'll be some tasks that undoubtedly we can easily apply the lens of AI. Maybe at the very front end of administrative tasks, the booking of an appointment, the management of a waiting list. There's probably the other end where it's more difficult. Do we use AI in diagnostic decision-making? Do we use AI in analyzing a diagnostic image or a diagnostic pathology result? Do we use AI for clinical decision-making from a consultation? Or, put more simply, can we use it for the transcription and transference of a consultation between a clinician and a patient? There are so many use cases for AI, some that to a greater extent will be used on their own, and some to a lesser extent, some where they might be used to augment what the clinician does, and some where they potentially could help supplement or even fill the void of where the healthcare workforce is simply missing. But with all of this, and with AI, we know that AI needs training, it needs engineers, it needs clinical engineers, it needs data scientists, it needs analysts, it needs people to feed AI, to nurture AI, to create AI. And so on the one side, yes, absolutely, there are going to be components of task, function, work that currently take place across a range of healthcare settings by different skill sets that could potentially be augmented by AI, supplemented by AI, and even replaced by AI. But just as quickly as we do that, we're also going to need to produce all the other jobs and roles to then support AI, creating AI itself, engineering, constantly mining it, watching the clinical safety. So yes, AI could help, but it might also create a whole other list of jobs and tasks that will still need filling.
Awesome. Great answer. And thank you for bringing up this point. It is like giving us a clear view that the revolution, the technological revolution that is happening not only in healthcare, is bringing the opportunity for new job opportunities, but also this great challenge on how to shift from the today's mindset to the new one, and maybe changing healthcare, changing hospital space from the currently used for a couple of centuries now, like typical bed settings, to be honest, technological machine that is collecting data, managing that data, and using that data to help alleviate people's life.
And we can
That's a great point.
In other sectors, if we look at retail and the sort of dot-com boom that took place at the end of the 90s, beginning of 2000s, on the one side, we saw the void in the retail space picked up by technology. But we also saw the creation of a whole industry. The tech industry effectively became a sort of fourth revolution, if you like, and created more roles. So we've seen this in history. And I think if history is to repeat itself, on the one side, we will see technology, machines replace, complement, supplement, augment certain functions, but we'll see a whole new range of roles get created. And I think that's the nature of really of human evolution, where we've seen some roles get replaced by technology, whatever technology it is, and others get created.
Great point. And I think this connects really well with the topic that we are observing for a couple of months now. So generative AI and latest ChatGPT advancements. So people nowadays are saying, or the topic has started, that there would be, in maybe not even years, but a couple of months, there will be a new job titles. I'm referring mostly to the job title called prompter, that will be directly connecting with the AI and getting inputting the data and getting the knowledge out of it with its help. So we will see how it will definitely change the whole market, the whole industry, and we'll see how and if it will change also the healthcare sphere.
I mean, is it just a matter of time before we see a role which is clinical prompter, right? We've had chief medical officers, we've had chief clinicians of all kinds in digital. Are we going to see clinical prompters, a bit like we saw clinical coders? I think we will. I think there'll come a point where there'll be clinical prompters in healthcare.
That's great. That's a great point. Moving on, wanted to touch a bit on your experience as an NHS consultant. So I recently saw on LinkedIn that you published a really great blog post on the challenges the NHS faces in its digital health revolution. And two notable challenges were navigating the risk of our growing reliance on technology and leveraging technology efficiently. And do you think these obstacles will be made better or worse by the latest buzz and adoption in AI?
Well, sadly, I think I'm going to disappoint our listeners and viewers. Both. I think it's both going to make things worse, but also make things better. And you might think, well, why would I say that? Why would I think it's both? I think on the one side, there's the race to implement AI, whether or not it works. And it's a little bit like apps. If you imagine there's 350,000 apps out there and there's a race for people to get them out there. But the ones that are most used may not be the most useful or even those that work, but they happen to be the ones that people like the most. And we'll see this with AI. We'll see this race for people to adopt AI. It's the new buzz in town. Who will get there first? Who's got the story? Which politician can stand in the media and say that they've adopted it? And whether it's the UK or anywhere else in the world, we see this all the time. There are also some problems, though. There's been some skepticism particularly in healthcare, around the use of certain types of AI, and really some of the skepticism from the adoption of it because of some big failures. There have been some big scandals, whether it's been around products that have been designed to examine skin and missing certain types of skin, whether it's been products that have been poorly used and have misdiagnosis. And so we've got that. The other side is the promise of AI versus the reality. We've had some big promises in the past. If we go back in time and think about when Watson was first promised and other things were promised in healthcare, we've seen what's happened, where it underestimates the amount of training that AI might need. It underestimates the actual potential of it, how long it takes to go from really from testing all the way through to implementation. So the skepticism and the big failures have really been something that will have set the sector back in many ways, but also created some healthy challenge around whether or not it can even work. And then there's the lack of ability for poorer health systems and poorer health industries and sectors to catch up. It might exist, but will they ever really catch up? Are we just simply widening the inequality between health systems? Probably are. And certain parts of the world will see that more so than others. But there's the other side of it, the patient and clinician expectation. In our lives, every single day, you, I, and everyone else are using components, dimensions of AI. And if we think about the use that we might have in our smart devices and our phone, in our computers, in other tools that we might use, even the generative AI that we all now commonly use, the one that most people probably are familiar with, it's out there. So this creates expectation, but our health systems aren't ready to catch up with this expectation. So we see the adoption of AI, certainly generative AI, in a way that wasn't intended. It wasn't intended to be a medical device, but it might be used like that. Now, in some parts of the world where they don't have access to healthcare, health information, maybe that's a good thing. It gives them access they wouldn't have had in a system where everything else is far worse. But in other health systems, which are much more, perhaps, if we like, mature health systems, sometimes this can become a hindrance, because if these tools were not designed as medical devices and medical grade products, but they're now being used that way, who's responsible for safety? Who's responsible for privacy? What happens? We've also seen certain types of AI, generative AI, where certain countries for a period of time had to ban them. We've also got the other problem where if they are used, who owns the intellectual property? This is yet to be bottomed out. So what do I think? Well, there are lots of obstacles to overcome. There are lots of use cases that make them attractive. And I think we'll see in some areas, well, things will be better from the adoption and the buzz. In other areas, we'll see problems emerge and new problems that we didn't expect before. And certainly hallucinations are still a problem for certain types of generative AI. But of course, generative AI is not the only one. The other side, if we look at things like AI that's using diagnostic imaging, once we've got to the point where people have good confidence around the effectiveness and that they are medical grade devices, they might actually help our health systems, because we will see that they will reduce the burden in some clinical workflow areas. So is it better or worse? It's still both.
Thank you so much. And touching on that, I have another question. You mentioned about mature, calling it like a mature hospital or health system. How would you define a digitally mature hospital or health system? And you mentioned that already, and I feel that you kind of were saying like AI can play a role in that definition, but how would you define a mature health system? And can you point out any examples nowadays that we can see already existing system like that we can all learn from, or there is still like a run and a job to be done?
I think there's always a job to be done. And the definition of
True.
digital mature system should evolve. The definition we use today should not be the definition we have tomorrow. The standard of a digital mature system should evolve itself, a bit like the technology. All the risk is we end up stuck in the Stone Ages. And certainly, if I look at certain hospitals around the world, particularly in the UK, but the same exists in other parts of the world too, many of these places were built around place a long, long time ago, almost 100 years ago, sometimes longer in some cases. And certain hospitals I know were built almost 300 years ago. And so when we look at these things, the standard of a digital mature system, which incorporates the places, has to evolve. So what do I think it should be? Well, for me, a digitally mature system is one that is citizen-centric. It's driven by outcomes, not by the state of the technology. It's one where the use of technology exists in all parts of the journey for the patient, but is not confined to any one part of the patient journey through that health system. And that digital maturity goes hand in hand with data maturity, because a digitally mature system is only as good as the data on which it is designed and built. And one where we have concepts such as a digital twin. So these are components of a digital mature system, but I say components because it relies on standards, evolving standards. It's one that is safe, it is secure, it is private, and it's one which is forward-facing. It's using the future digital technologies. But what we think of today as being future, which might be distributed ledger technology, AI, quantum, and XR, may not be what is digitally mature tomorrow. That itself might evolve. So right now, these are some of the things we think of, but they will evolve. And I suspect people listening will be creating what might be a future digitally mature system. But the most important thing is it's citizen-centric, it's creating better outcomes, it's reducing cost. And those should be some of the features of a digital mature system.
Thank you so much. And I think there will be needed so many new components that needed to be incorporated in our daily habits to really create this digitally mature health system from both sides, not only from physicians that needs to learn new ways and new ways of consulting their patient, but also from the patient's side habit. So I'm speaking about like Internet of Things, how to combine the data of our wearables, how to.
I mean, look, you're right. You know, Internet of Things, data from patients will form part of that. In fact, if we look to a hospital in the US, like Mercy Virtual, which is the only virtual hospital, it's a hospital without beds. And so we will see a time where this becomes more common. I will not say the only thing, and it will depend on the health system to the extent to which it's adopted. But I definitely see a place where patients will hopefully be more in control of their own destiny. Their data connected to their own device will help them work out what it is that they may need and even give them the signals to go and do something. It will change the face of prevention. So in that digitally mature system, at the center of it is prevention, and it is going to be using those connected devices, whether it's apps, whether it's wearables, whether it's some other technology. But I'm glad you mentioned Internet of Things, because we also see a space where the Internet of Things is growing. Its use in healthcare is growing. The use of connected devices, medical devices in healthcare is now probably at a scale that it was never before the pandemic, certainly. But with this comes a new challenge, the challenge of sensoritis. How many pings, noises, notifications do we all have going off that distract us on any one day?
Right.
Amplify this in healthcare. How do we make sense of it? Do we have overload? And so, yes, we will have more connected devices. The Internet of Things will become greater. But at the same time, we need methods, mechanisms in place to deal with the problem of sensor overload. How does a clinician or a patient make any sense of it? So, yeah, I'm all for the Internet of Things become part of our future and better data, as long as we find a way to use it in a controlled way that doesn't overload the individual, whether it's clinician or patient.
Thank you for that. That's super important, and I cannot wait to see patients as being managers of their own lives, of their own health, being like equal person to have a conversation with a doctor, not only for in many occasions only receiving informations and trying to do something with it, but exchanging informations and also being an equal partner in conversation. Sam, because we are running out of time right now, and purely because of the formula of our blog series, we need to wrap it up our conversation. But I can feel that it can go on and on for a couple of more hours. So thank you so much for today. Thank you for this discussion, and hope you will have a great rest of the day.
Thank you, Michael. It's been a pleasure joining you today. Really glad to have joined you, and look forward to speaking on.
Thank you so much.